We're going to look at the three most important things you need to know about peptic ulcer disease. And this is going to be a practical session. The approach I'm going to take is from a practical point of view. So it's not like using medical terminologies, medical terms to confuse a layman. So we are going to just look at the three things. And the first thing is to look at signs and symptoms. So if you can see, I'm not going to follow the medical approach. It's just like a discussion and a practical session. And peptic ulcer disease, when we say peptic ulcer disease, we commonly call it ulcer. But the peptic ulcer means gastric ulcer or duodenal ulcer, because the upper part is a condition that affects the stomach. It affects the stomach. So if it affects the upper part of the stomach, that is the gastric ulcer. Then it affects the lower part of the stomach, where it is now emptying into the small intestine. That is called duodenal ulcer. But both gastric and duodenal ulcer are called peptic ulcers. So just to make you understand what we mean by peptic ulcer, is both, either it is gastric ulcer or duodenal ulcer. But ulcer generally is causing a lot of havoc today in the society. And as a medical doctor, I have seen, who has worked for many years, I have seen a lot of people experiencing this particular disease. And it can range from mild to moderate and then to severe. Mild means is when you are feeling it in a little bit, while severe in a layman's term means when the ulcer is serious. And the moderate means it's not mild and it's not severe, serious, very much serious. So in between, that is moderate. So you can see me using these three classifications. Either the ulcer is mild, that is a little bit, we'll define that, moderate, in between a little bit, and then very serious one, and then severe one is a serious ulcer. It's a serious one. So generally, as I said, it affects the stomach. And what causes it? Commonly in our environment, that is one of the three most common causes in our environment. One is that particular bacteria that is called Helicobacter pylori. And the second cause of that is abuse of drugs, particularly NSAIDs, non-steroidal anti-inflammatory drugs. They do also cause ulcer. All this cataplam, all this ibuprofen, all this aspirin in particular. But all these NSAIDs that people in our environment have usually turned ourselves into also doctors, making prescription for ourselves, or going to chemists and pharmacists and then telling them our problems. And most at times we are being given analgesic, that is painkiller or pain reliever. These pain relievers, when they are taken in large amount, or if they are consistently taken, they can also cause ulcer. But apart from ulcer, we should understand that these pain killers can also cause kidney diseases, because kidney disease is also on the high side. And one causes today is painkillers, particularly in people that are from 40 years and above. You know, these are people that are commonly complaining of pains here and there, headache, the joint pains, knee pain, back pain, generalized body pain, and people resort to taking analgesics, that is painkillers. These can cause ulcers, and they can also cause kidney diseases. And the third common cause of ulcers in our environment is haphazard or irregular dietary regime, meaning to say that one changes the time that you take your breakfast, lunch, and dinner. Usually the time by variation, when you fix it, it should not be plus or minus 1 or 2 hours. Meaning to say that if you usually take your breakfast by 7, then let it be, let's say, 5 a.m. to 9 a.m. But if you are now taking your breakfast by 7, then today, tomorrow, then next day you take by 11, then another day you take by 12, then another day you take by 8. There is lack of adaptation by the stomach in the production of the hydrochloric acid that we'll discuss later. So the third cause of that is the way we eat, which we will also discuss it on the second part. But the first part is the signs and symptoms. When you look at the causes, we do not need to be told some of the signs and symptoms, because generally in Nigeria, it has been documented that over 100,000 people experience peptic ulcers annually. Over 100,000 people annually in Nigeria. So it's a very serious thing. And if you take 20 people randomly, 18 to 19 of them will tell you that they are experiencing one form of ulcer or the other, meaning whether it is mild, some will say mild, some will say they have moderate ones, some will say their ulcer is even severe one. So what are the signs? Usually it's a pain in the upper abdomen. Usually around this position, if you can see it, I'm demonstrating it to you, around where your ribs end, the sternum, the end. These usually people will tell you that they are experiencing pain around that particular area. So this pain is what commonly people use to diagnose ulcers. Self-diagnosis, we diagnose it for ourselves that we are having ulcers. In fact, many a times when clients or patients come to doctors, they will even tell you, before even telling you their signs and symptoms, what they are experiencing, the symptoms they are having, they will tell you that I'm having ulcer, or someone in one particular chemist or pharmacy has told him or her that is having ulcer, or a particular person that is close to the person or the person is associating with will tell that particular person that he or she has also been experiencing the same thing, and a doctor or somebody has told that person that it is ulcer. So that particular pain, in a practical term today, because today we want to see it from another light, that is not all pain in the upper quadrant in the chest here that you will term as ulcers. Because today, I want us to understand that there are other organs apart from, there are other organs that are there apart from apart from the stomach. There are other organs there apart from the stomach. You can see that in that particular area, apart from the stomach, close by in relation to it, you have the liver there. You also have the pancreas there. So and you also have the lower part of the lungs, and you also have the heart close by. So sometimes the pain may not be emanating from the stomach. It may be from the liver, or from the pancreas, or from the lower part of the lungs, or from the heart. But generally, because we do not know the organs, the structures that are situated around that particular site, we generally say that I'm having peptic ulcer. So it is when you say your signs, you tell the professional your symptoms, that the health professional will now know whether the problems you are having are usually as a result of peptic ulcer, or not. So pain in the upper part of the abdomen or chest, upper, that is, we say epigastric region in medical term. And then sometimes there is experience of nausea and vomiting. And then some people will also be having bloating or belching. And in the severe form, some of the patients will be even vomiting blood. Or when they eat food, the food will not stay in their stomach. Immediately when they eat, they will vomit it out immediately, and sometimes with even blood inside. Or if they eat food, they experience the pain. The pain become more severe. Or some, when they eat, they get relief of the pain. That is the differentiation between the duodenal ulcer and the gastric ulcer. Or sometimes people will be having feeling of fullness of the stomach. All these are symptoms that may be associated with peptic ulcer disease. And there are signs that are that elicit those particular symptoms or that are associated with peptic ulcers, that a health professional will now check and see if you are actually having peptic ulcer or not. So before we go to the second aspect of what to do, still under signs and symptoms which you may put out your concerns. Every concern that you have concerning peptic ulcer today, you are allowed to ask or to make contribution, or if you have anything, any notion or idea that is contrary to what we are discussing today, you bring it up so that it will be clear, it will be thrashed out for you. Then there are certain investigations that are carried out when somebody comes with signs and symptoms that are suggestive of peptic ulcer disease. One of them is they will take your blood and check for the bacteria that we mentioned earlier, the H. pylori. If it is present in your blood, it means that particular bacteria that is causing gas to accumulate in your stomach and is contributing to the production of HCl, which erodes the stomach lining and in some cases causes bleeding that you will vomit, that we medically call hematemesis, in the severe form of it. Then another investigation is you may undergo X-ray, but when it becomes severe, you may even undergo one of the radiological investigation that I don't want, endoscopy. Endoscopy is a very strenuous investigation, but when it warrants for it, there is no option. One will look for it, himself or herself. But endoscopy is where they use an NG tube. They use a tube to put inside your stomach to visualize the inner line of the stomach. Is very expensive and it is not done everywhere. There are selective places that this particular investigation is done, and I will cite you certain examples along the line regarding that endoscopy. And then when it is diagnosed, there are pharmaceutical drugs that are being given to address peptic ulcer disease, to manage peptic ulcer disease. And if it is as a result of excess hydrochloric acid in the stomach, what usually drug that is given that usually reduce the production of the hydrochloric acid, HCl, hydrochloric acid in the stomach. And if it is as a result of the bacteria, the H. pylori, then antibiotics are given that will kill the bacteria. So that being said, we come to the second part. What shall you do? What to do? Here, I will categorize it into two. One is if you have peptic ulcer disease, whether mild, moderate, or severe, what is it that you should do now? To either reduce it or cure it. The second part is if you do not have peptic ulcer disease, what are you going to do to prevent yourself from getting peptic ulcer? What are you going to do to prevent yourself from getting peptic ulcer? So what we will do, as I said, we look at the causes of the three common causes. There are others like stress can also cause peptic ulcer and is very common in our environment also. What you can do, one is you should put a regimen and timing to when you take your meals: breakfast, lunch, dinner. Long variation in hours between breakfast and breakfast today, breakfast tomorrow, breakfast the day after tomorrow. I'm trying to simplify it in layman's terms. Is one of the factors that may cause non-adaptation by the stomach to know how much amount of hydrochloric acid to produce, when it is supposed to work, when it is not supposed to work. So you should have a regimen, a discipline, variation of 1 hour plus or minus to when you fix your breakfast, your lunch, and your dinner. And then this is for those that have peptic ulcer disease and those that do not have peptic ulcer disease that want to prevent themselves. And then for those that have the peptic ulcer disease, if you are bloating and you are belching a lot, it means there is excess gas. That is another sign that the hydrochloric acid in your stomach is in excess. So we usually give you a pharmaceutical drug that will reduce the production of the hydrochloric acid. But that means that also you should increase the number of times you eat food during the day. Let's say instead of 3 times, it should be 6 times, 7 times at regular interval of 2 to 3 hours, but not usually to fill your stomach. No. Even if it is a biscuit or 1 apple that you can take 2 to 3 hours, let's say for 6 to 8 weeks, that one will take care of the excess production of the hydrochloric acid, because it will give the hydrochloric acid what to work on when you put something inside the stomach. This brings us to the information that, hydrochloric acid, we know acid. For those that know that in a car battery there is water, there is a liquid, that liquid we call is acid. Acid. And you know how corrosive it is. If you take that particular acid from your car battery and you allow it to touch your cloth, immediately it will tear the cloth. So hydrochloric acid is like that. It's also corrosive, but it is very important to be produced in the stomach. But because it is used to digest whatever you eat in the stomach. So for digestion in the stomach. So it is when it is in excess, it is too much, that it will now cause problem. And part of the problem is that it will start eating into the inner line of the stomach. It will start eating it up until when now it erodes it and now reaches the blood vessels and puncture them. And once it puncture them, you know, the inner punctured will start bleeding. That area is what is termed as ulcer. That is the term ulcer medically. And that is why you'll vomiting blood, or when you eat food, it will not stay in your stomach, or it stays for a little while and you vomit it out and you see it mixed with that particular blood. Because that corrosiveness of this excess hydrochloric acid is eaten up into the inner line of the stomach. So by eating regularly, if it is as a result of excess hydrochloric acid, 6 times, 7 times, but a small amount, even 2 pieces of biscuit you take, it will now enter your stomach and give the acid what to work on. It will now start digesting it. When you do that 6 to 8 hours, I advise people, when you do that 6 to 8 weeks, 6 to 8 weeks, you will see that it will start coming down, meanwhile taking other measures that you can cure it completely or address it, or if you want to now cure it and then prevent it. But for those that want to prevent it, what to do first relating to the diet is you should fix a regimen for your meals: breakfast, lunch, and dinner. And another thing that people need is education. This is not a question of whether somebody is literate or illiterate. No. You will find highly educated people with first degree, second degree, third degree. But because it is not their field, they do not know when they should eat food during the day, during the 24 hours, and when not to eat food. Anytime they feel like eating food, they just take food. And that is another topic for another day, that will give us a holistic approach into a quality lifestyle, 4 cardinal symptoms of quality lifestyle. But here is relating to the regime on when to eat food. The second thing to do is that if you have peptic ulcer and you understand that the aggravating factors, meaning to say that what will prompt the ulcer to come back, or what will make you are feeling some pains, but what will make it so that you will feel the pain more, increase the pain. That is what we call aggravating factors. When you have aggravating factors. One is when you eat food that contains much pepper. Please, you avoid it. You what? You avoid it. 2, some, when they eat food that is too oily, that contains much oil, it also aggravates them. Like if they eat kosai or waina or moi moi that has a lot of oil, usually it aggravates the pain. It makes them to experience the pain more, or even if they have resolved the issue, it can make it to come back. And the third one is some people, when they take a sour food, it also aggravates the pain. So you avoid your aggravating factors. Caffeine also aggravates ulcer pains in many people. So you avoid caffeinated drinks so that you will avoid the aggravating factors. And for those that do not have peptic ulcer, what you should do, the second thing you should do is all these aggravating factors that we have mentioned, you should be taking them in moderation, not in excess. You should be taking them in what? Moderation, to prevent yourself from getting peptic ulcer. When it is in the severe form, it is fatal. And I will tell you certain stories. Then what are you going to do? The third one. What is third thing that you need to do if you have peptic ulcer disease? Is to avoid stress. And also, if you want to prevent peptic ulcer disease, you should also what? Avoid stress. And what is the fourth thing that you should do? Whether you have peptic ulcer disease that you have already resolved it, or you have peptic ulcer disease that you are trying to resolve it now, or you do not have peptic ulcer disease at all. The fourth thing that you should do is regularly be checking your H. pylori, because it's endemic. It's very common in our environment. The bacterial causative agent for peptic ulcer, you should be checking it regularly in your blood. It is not expensive. But if you allow it to get into your system and to also eat you up and lead to severe form of peptic ulcer, the cost is far cheaper than the disaster that it can cause. So every 6 months or every 1 year, as you can, please try and go and check your H. pylori in the hospital. Today, labs are everywhere. And in many cases, many of us are doctors. Almost everybody in Nigeria, I didn't say all, I say almost everybody in Nigeria is a doctor. Inna lillahi. Sorry for the interruption. Can you hear me? Please, somebody should let me know if you can hear me.
Yeah, we can hear you.
Okay, thank you very much. So as I said, I just switched to this thing, to my phone, because I have challenge. The laptop has challenge also. I don't know. So as I'm saying, the fifth thing that you should do is the last thing that you should do is you should go for checkup. Check your H. pylori. It's very common in our environment. Please and please, if you want to do good for yourself, these things that I have mentioned, you try to do them. If you do not have peptic ulcer, if you have peptic ulcer, you should also do them, including increase the number of times you eat during the day, or you put something, let me use the proper word, a number of times you put something into your stomach, at least for 6 to 8 weeks, so that you give the hydrochloric acid something to work on. Then the last part, quickly, is about what to eat. If you have peptic ulcer disease, what are you supposed to eat? And if you want to prevent peptic ulcer disease, what are you supposed to eat? They are all the same thing. First, you should eat food high in fiber, because food that is high in fiber gives the hydrochloric acid a lot of work to do in the stomach. So we should be mobilization of a lot of hydrochloric acid to digest fiber in the stomach. So a food high in fiber is very, very important. And some of them contains other nutrients that are very good in managing ulcer and also preventing it. Food that contains nutrients that neutralize the hydrochloric acid, they neutralize the excess hydrochloric acid. And also these foods that we should be taking, like oatmeal, cayenne pepper, food rich in fiber, you will see that some of them are available, some of them are not available. And in the type of food we eat today, where most of the food we eat today do not contain enough nutrients that are very useful in the catalyzation of food, and in also in helping. Sorry. So these food that are usually rich in nutrients mostly are not available to us, and it is only within the reach of few people. And you can see that what we usually take are what? Indomie, spaghetti, rice, yam, sweet potatoes, you can name them. In many cases are processed food, which when they enter into the stomach within 1 hour, 2 hours, they are digested and they will pass down. So you usually have an excess amino hydrochloric acid that needs something to work on, which is not there. And once there is not enough thing for the hydrochloric acid to work on inside your stomach, it will now start eating up the inner lining of the stomach. So here brings us to the supplementation and the remedy for the peptic ulcer disease that we commonly use today. And we are going to look at these three products, the Forever Aloe Vera Gel, Forever Bee Honey, and then Forever Fields of Greens. But before I mention anything here, I must tell you that these products are lifesavers to me because I have seen them saving lives. In 2017, there is one of the rich people in Maiduguri, up to today, one of the rich people. If you want to mention 30 rich people in Maiduguri, you must mention that person. What happens is that one of his wives was experiencing severe form of peptic ulcer that led her to even going to Jos teaching hospital for endoscopy and a lot of spending of money within Nigeria and outside Nigeria. But in 2017, she came across these products and we gave her Forever Aloe Vera Gel and then Forever Fields of Greens. When she started taking it, after a day or two, most of the symptoms started resolving quickly. But there was still complaint that whenever she eats food, it doesn't stay in the stomach, she vomits it out along with blood. So we now added Forever Bee Honey. On the second day of including the Forever Bee Honey, up till today, 2023, from 2017, this woman has not known ulcer again. And she only used these products for 3 months. 3 months compared to what her husband spent moving from one hospital to another outside the country. This is a testimony that I know and I am personally involved. Secondly, This is also another one. It happens to one of my chief nursing officers, who is also a friend of mine, but is elderly to me. He is having peptic ulcer. From moderate, it moved to severe form, where he vomited some blood. That was in 2019 early. And then we were managing him. And then it led to a point where he lost some blood. And one of our co-nurses, one of the nurses also donated 1 pint of blood, and another one also donated another pint of blood. So we were transfusing him. We were to transfuse him 2 pints of blood, 2 bags. Let me use the later language: 2 bags of blood, 2 bags of blood. So he was on the first one on admission in our facility when they rushed to the quarters to call me, and they told me that my colleague was vomiting blood, frank blood, complete blood. And it is just a 3 minutes distance from where my house is to where I will reach him in the ward. And on reaching there, I saw him in full of blood. I think he vomited more than 2 liters of blood. And he was even about to go into shock. So we started pushing the IV fluid. The beds had already collapsed. We were rushing to get IV line we couldn't get, and he has started going to shock, though irrational. So I now told him, where is the aloe vera that you collected? He said he has not taken it. It is at home, because as a friend, I dashed out one to him. So we quickly get one, and we open his mouth, give him some, like half a glass, and then he swallowed it. About 30 minutes, we gave him another one, and in between, he did not vomit. And the vomiting immediately stopped. And we got a car. I rushed him to Yola, to a Federal Medical Center. And a distance of 2.5 hours to 3 hours drive. And he did not vomit. And he has up till today been saying that God is his savior, and forever aloe vera gel is his savior, because without that, he didn't know where he would have been. And after admission, diagnosis was made, and it was severe. Was sent to Jos Teaching Hospital. He went, and he even underwent 3 stages of banding. Because of the severity, they couldn't do it at a go. They do it in 3 stages to tell you how severe his peptic ulcer was. And along what helped him were these supplements: Forever Aloe Vera Gel, Forever Fields of Greens, Forever Bee Honey, and then Forever Active Pro B, the 4 products. They were the ones they were the products that helped him. So these are 3 products that if you want to prevent yourself from peptic ulcer, you should be using them. For those that do not have peptic ulcer, I usually ask them to be using aloe vera gel alone if they cannot afford the 3 of them or 4 of them. And also for those that have mild, what do we mean by mild? That it comes from time to time. It is when they undergo stress for 2-3 consecutive days, they start experiencing it. Or when they eat a food containing much pepper consistently for 3, 4, 5 days, that it will come back. But otherwise, when they take drugs, it relieves and go. For those people, I tell them that you can manage your peptic ulcer with only aloe vera gel and fields of greens. When you take it for 6 to 8 weeks, believe you me, you may be even taking those particular aggravating factors, aggravating foods that you were before, that you could not take them before. When you take these for 6 to 8 weeks, if possible, 12 weeks, 12 weeks, that is 3 months. And I should tell you that Forever Aloe Vera Gel does not only prevent you from getting peptic ulcer, it cleanses the whole gastrointestinal tract, your whole GIT, from your mouth to the esophagus, to the stomach, to small intestine, to large intestine, up to your rectum. So it washes everything from up down. And if you do not know the magic of this product, the Forever Aloe Vera Gel alone, you should know that inside that 1 liter, 1 jar of 1 liter that you are seeing here on the screen, it contains 75 different nutrients, and there are 20 minerals. When we say minerals, 20 of them: calcium, magnesium, zinc, copper. And there are also 12 vitamins inside this 1 jar of 1 liter of aloe vera gel, and 18 essential and non-essential amino acids, and over 200 active enzymes, all inside this 1 jar. But that is not all. What I intend to tell people is that apart from out of these 75 active ingredients, active nutrients inside Forever Aloe Vera Gel, there is saponin, one good nutrient that usually cleanses the entire gastrointestinal tract. Just like Omo or soap will clean your dirty cloth, that's how saponin in aloe vera gel will clean the whole gastrointestinal tract, including the stomach, small intestine, large intestine, and the rectum, and push everything down. And there are other things also. There is also pain inhibitors. I have not seen a painkiller in our pharmaceutical drugs. To me personally, that's my opinion, not a medical opinion, like Forever Aloe Vera Gel. And as a disclaimer, you should understand, these are not orthodox drugs, chemist drugs, or pharmacy drugs. These are natural organic products that works wonders. So if you look at the stomach, look at it. You can see the dirty one on your right side and then the clean one on your left-hand side. This is how aloe vera gel will clean the gastrointestinal tract. And it also contains anti-polysaccharide sugars complex that fights microorganisms. Microorganisms including the bacteria that we mentioned, fungal infection, viral infection, and then parasitic infections. So it's a complete pack when you have Forever Aloe Vera Gel, for those that have peptic ulcer disease and for those that also want to prevent it. What I tell people is that if you are having peptic ulcer and there is excess gas in the stomach, very early in the morning on an empty stomach, take half a glass of Forever Aloe Vera Gel, follow it with a glass cup of water immediately. And within 5 to 10 minutes, if you didn't belch, you didn't belch, believe you me, that ulcer is not as a result of excess hydrochloric acid. Because if it is excess hydrochloric, you will see yourself belching, the excess acid, the excess gas will be coming out, Then here is a research that has been carried out by the Royal College of Physicians in London, where it says 90% of all diseases begin in the digestive tract due to unclean colon, meaning to say that 90% of diseases we are having are as a result of unclean colon, dirty colon. So if you clean your colon, meaning intestines, it means by and large, you are preventing yourself by 90% from contracting diseases. That's what it implies. So you can see the importance of cleaning the intestine and coating the stomach to prevent the acid from eating into it. Then the second product is the fields of greens, which is also a wonder. But before I talk about fields of greens, aloe vera gel, I tell people that it is not about the cost. Personally, because I have seen it work in many cases, in many different situations, medical situations, I tell people if I buy forever aloe vera gel at 50,000 naira per jar, it's still very cheap compared to how I see people running from one place to another looking for medical help due to peptic ulcer, spending huge amount of money. Some even moving when it is in severe form from this country to other hospitals abroad. So the second product, the forever fields of greens, all the greens and grasses are there, meaning to say that it has fiber, as I mentioned earlier. When you are taking food, take food high in fiber, not these processed food that when you take them within 1 hour, 2 hours, they are already digested and they are moving to the small intestine from the stomach. So take food that are what? Rich in fiber. And Forever Fields of Green does that. And if you want to manage peptic ulcer, you need no other nutrient that cayenne pepper, which is in abundance, in the proper amount inside our Forever Fields of Greens. And Forever Fields of Green contains chlorophyll. What does chlorophyll do? It cleanses the blood. It will clean your blood completely. And that is why Forever Fields of Green is a very important component for patients with sickle cell disease, in patients with kidney disease, because they cannot what? Remove creatinine, they cannot remove urea from the system. And chlorophyll is a clearer, is a cleanser of the blood. And that's why Forever Fields of Greens is very good for diabetic people. Because apart from cayenne pepper that addresses that particular epigastric pain that mimics what? Peptic ulcer in diabetic patients, it also contains chromium piconate, which also regulates blood sugar. So if you don't have peptic ulcer, you are taking peptic fields of greens to prevent yourself from peptic ulcer. It is not only about peptic ulcer. Taking Forever Fields of Greens also helps you to what? To clean your blood because of the chlorophyll that it contains. Other nutrients and components that are very good in preventing you from getting a lot of gastric or gastrointestinal conditions. So Forever Aloe Vera Gel and what? Forever Fields of Greens. Forever Bee Honey is also very good in addressing the problem of what? If you can afford, put all the 3 or 4, particularly those that are experiencing hematemesis, meaning to say that those that the ulcer is so severe that they are even vomiting blood, or when they eat, the food doesn't stay in their stomach, they immediately vomit it out, or after 30 minutes, 50 minutes, they vomit it, or they only take small amount of food and they will feel fullness of the stomach. In these cases, you should add forever bee honey in the pack. And then finally, forever active for bee. Anybody who wants to take care of the stomach, put all the four: forever aloe vera gel, forever fields of greens, forever bee honey, and then forever active from bee. But because of lack of time, I will not go into that much because it will take me 15 to 20 minutes discussing only forever active from bee. This is special product from Forever Living Products and patented to only Forever Living Product. It's a special product like no other, but it's very important in addressing issues of the digestive system. For listening, because we have taken a lot of time, I will give you some time, some minutes to ask questions if you have them, and you have a lot of channels to ask your questions. You can either type them here in the chat box, or you can raise up your hand to ask for permission to be allowed to. If you have contributions, you can also make either through the chat box, or you can also raise up your hand and then you'll be allowed to also speak. And if you have another perception or another idea or another notion or another concept relating to peptic ulcer, which does not conform to your own, you can also raise it up so that we can also discuss it, because today is all about peptic ulcer disease in a practical term. And we will be allowed also to also make your own contribution in the discussion. Thank you very much. Thank you. Waiting for you.
Thank you so much, Doctor. We really appreciate this amazing presentation. Thank you so much. All this information just free of charge to us. Thank you so much. Words are not enough. Please let all of us give Doctor the emojis as much as you can. Before we start asking questions, let's thank him, because we know money cannot pay for this, but he has given it to us free of charge. Thank you so much, Doctor. It's only God that will help us reward you. You are a blessing to our generation. You are a blessing to our group. You are a blessing to every one of us. Thank you so much. In fact, I'm waiting for the recorded version to share to all my clients that have been disturbing about stomach ulcer, peptic ulcer, everything. All the questions, they will understand why they need to use it. Tempo, please unmute 2 hands that are raised so that they can ask their question or share their opinion. Thank you so much, Doctor. We are really, really grateful. Members of HPG and Power team together, we are grateful. Tempo, please unmute the 2 hands.
There is Princess. Unmute the 2 hands. Princess, I'm not, you said that you know that I'm talking to you. No, I'm not talking to you. But clear your mind today. If you have any notion or idea relating to peptic ulcer that is contrary to what we discussed, or you are looking for more information, you can also talk. Thank you.
I've unmuted them.
Okay, good evening, everyone.
Good evening.
First of all, I would like to appreciate Dr. Barua for the wonderful presentation. This is a very good presentation. Thank you very much, and it's educative as well. So, Doctor, can you hear me?
I can hear you.
Yeah. My question is about the sign and symptoms of the peptic ulcer. I have heard that people are complaining of back pain, and they say it's also a symptoms of the peptic ulcer. And you did not mention back pain when you are explaining the sign and symptoms. So this is what I did more clarification about. Thank you. And over.
Thank you very much for this one. We are talking practical and layman. Everybody is supposed to know what to do or what not to do today. That's why I said we are to discuss the three most important things we need to do about peptic ulcer. The signs and symptoms, number one, what to do to manage your peptic ulcer or to prevent yourself from getting peptic ulcer. And then number three, what to eat. So what to eat is, I mentioned high fiber food, but the other food, just take your supplementation. These supplements that we mentioned are very cheap and they are available everywhere in Nigeria, so you can get them. But for your question, what usually called back pain and ulcer is not usually ulcer, but I will explain more. Back is not front. The stomach is on the anterior aspect. But usually in that epigastric region, there is a radiating pain that penetrates from the epigastric region, the back to the back. So sometimes if the diagnosis is made of peptic ulcer as a result of either excess gas or H. pylori, or there is a lesion in the stomach that suggests peptic ulcer disease and the pain is radiating to the back, not actually the whole length of the bone in the back. Let me use layman's term. Lower back, middle back, or upper back. No. They may be as a result of either lungs problem or whatever. But if it is in the epigastric pain, epigastric region, and it's radiating to the back, and even that can also be presentation of certain heart diseases, or if it is a little bit above the middle, it can also be as a result of, let's say, lungs conditions. So usually it's not for the patient or the client to make a self-diagnosis. It's for the client to see his health caregiver or health professional so that proper diagnosis should be made. And thank you for bringing up this also to tell you that a lot of people are misdiagnosing themselves, having liver problem, pancreas problem, heart problems, lungs problems, or even spinal cord problem, or vertebral column problem, and yet thinking that it is peptic ulcer disease, and thereby taking a lot of antibiotics, antacids, hydrochloric acid production, depressors, and other things like that, just to make sure that what they are trying to do is to say that I'm having ulcer, I want to, and if you take it today, after 3 weeks, 4 weeks, it will come back, and they will be saying, ulcer that this ulcer does not respond to drugs. So the proper advice I always tell people, if you are experiencing the signs and symptoms that are mentioned here, or the one that you mentioned, that it is in the epigastric region that is radiating, moving, penetrating up to the back, from the front back to the back, you should see your health caregiver so that proper diagnosis should be made and then appropriate measure be taken. And finally, also, there is no interaction. There is no interaction between your orthodox drugs that are given by your health professional and these organic products. Meaning to say that there is nothing like if you are taking, let's say, antacid, or you are taking omeprazole or something, that you are not going to take aloe vera gel or fields of greens, or there is nothing that the interaction means that if you are taking your orthodox drugs, if you are taking this organ, they can cause problem or something. No interaction has been noted so far between the orthodox, and even if you are taking the orthodox drugs, you can still go ahead and take this, because these are food that will address the problem at the root. You understand? While the receptor blockers for the hydrochloric acid, what they do is they reduce the production of excessive hydrochloric acid, And then when you take the dietary measures that you will address the adaptation of them, knowing when to produce, when not to produce, and you are giving them the right type of food, the production will not be in excess so much as to cause problem for your stomach lining and cause ulceration. Thank you. So I think I have answered your question, but if you have a follow-up question to the answer, you can still go ahead and do that. Thank you very much.
Thank you.
Any other person, the other person has also been enabled. If you can also make your contribution or ask your question.
Actually, doctor, the question I wanted to ask, you've already answered it. I'm on one of those medications for ulcer, but you said that it doesn't matter, that you can still take the other one as well. I mean, you can still take the aloe vera as well, which is okay. That was my question. Yeah.
What do you do if you are on the medications? Have you undergone endoscopy?
Yes, I've done all of them. I've done
So if you have,
everything.
it means your own has been severe form. For anyone to have undergo endoscopy, it means severe form. So you should get all the
Yes.
4 products: the Forever Aloe Vera Gel, Active Pro B, Forever Fleece of Greens, and then Forever Bee Honey. And you should take them for at least 3 months if you can. That one will surely, I give you a guarantee that you will see a different result this time around. Thank you.
Thank you, doctor.
So I've seen other people raising up their hands. If they can be enabled also, or were they the first 2 that we enabled them? If you cannot talk, you can still go ahead and type. I think we have, let's say, we have 11 minutes to close. We have 11 minutes to go.
Please enable them.
We have 11 minutes to go. We are going exactly by 9:45. So any question, you can type it or you can raise up your hand.
Ade. Tempo, please enable the Ade. Let that person ask the question.
They can ask their question now.
So the 2 of you have now.
They should move themselves.
Okay, there is
The 2 of you have been enabled.
There is Basil Onogu and Ade Fioye.
Hello.
Hello, we can hear you.
Hello, good evening.
Good evening, we can hear you. Good
Doctor,
evening, how
good
are
evening,
you?
everybody.
Good evening.
Yes, sir. Thank you very much for the exposure, sir. I want to know, sir, could pain all over the body, could it be associated with or to be called a ulcer symptoms?
Ulcer symptom?
Yes. Could it be part of ulcer?
No. But it can be indirectly when you are not eating food. The ulcer cannot allow you to eat food, or when you eat small due to hunger or something like that, but not a direct association with it. But it can make you to become weak, actually, if it is in the moderate or severe form. Yes.
Okay.
So if you are experiencing generalized body pain, I will just advise you on 2 things. There is a product in Forever Living product. Just forget about everything, whatever your issue, and do Clean 9. Take Clean 9. We call it. It is a pack of 5 products. Take it for 9 days. After that, you only take aloe vera gel for another 6 weeks, and you are done. You will entirely become a different person. Thank you.
All right. Thank you very much, sir.
So the second person. So before the next person, you can talk if you unmute yourself. Before the next person comes, I think I have not discussed this with my host, this information, but I think there is a need for me to talk about it as a doctor. Not this thing. That this month is actually about heart. So a lot of campaigns have been going on, like this one, that we have seen that the incidence of heart disease is very alarming in, will keep on.
Okay, can I ask
next,
my question? Doctor, my question is gastritis the same thing as ulcer? If it is not, what should one be taking? Because I have a pain, peptic sensation on my lower left abdomen, down lower abdomen. I have a peptic sensation early in the mornings. And if I go to gastritis, is it the same thing as ulcer?
I want to hear, I got that one. I want to hear what you are experiencing.
Yeah, the symptom I experience is lower left hand side of my abdomen. I experience peppery sensation early in the mornings, and after going to toilet, the peppery sensation will cease.
Okay.
And during the day, I won't even remember, but it's mainly early in the morning. It wakes me up around 4 a.m. I will feel that peppery sensation, but after going to toilet, it will cease. And there was a time I was diagnosed as having a gastritis. So I don't know whether it is the same thing as ulcer.
Gastritis is just that it is an inflammation of the inner. This is more like ulcer. It is done more commonly in, people that are diabetic will be experiencing like the same size ulcer, but their own is as a result of the uncontrolled, what do you call it, uncontrolled sugar level, or sometimes due to the diet regimen that they are undergoing. So even if you are experiencing that, I will also advise you that you take these 4 supplements for, let's say, 6 to 12 weeks. By God's grace, it will be a thing of the past for you also. Thank you.
Okay, thank you, Doc.
So somebody is asking us here, Princess is asking that how much can I get on? Princess, when the people start bringing issue of money, that is how even in the hospital we smile at as doctors. But because there are different platforms, the patient, the methodology, this platform where you are educating people. Person has pains, person comes with a problem, doctor. So you should know the approach to which you, because when you write drugs in the hospital or something, I mean, it may be genuine, not that severe, except if the financial help as a doctor. Where we give health education, you heard me say, personally, because of what I have seen forever, aloe vera gel. Even if you sell forever aloe vera gel, I will still go ahead and buy compared to not preventing myself from having. One close friend of mine, very young, 40 years, just a little about 40, very close friend of mine, was diagnosed with colorectal cancer. Colorectal cancer. And these conditions are very common in our environment. Gastrointestinal problems are very common, not only peptic ulcer diseases. Because our stomachs are dirty. Because what we are eating are not what our parents and grandparents were eating. We are eating a lot of processed food and junks. thereby seeing a lot of adults today coming down with rectal problem, coming down with stage 3rd degree, 4th degree hemorrhoid, pile, if we call it in Hausa, basal. All these as a result of having dirty or unclean colon, gastrointestinal tract. So aloe vera gel, fields of grain, and active for B, as I mentioned earlier, will help prevent you from by 90%, as the Royal College of Physicians said, not by me. This was documented the Royal College of Physicians, London, by 7 matter. But I also said that if you are on his mind, you cannot afford all the 4. You can take forever aloe vera gel alone. But better still, forever aloe vera gel and fields of greens. But once your ulcer is moderate to severe, definitely you need all the 4. Forever aloe vera gel, fields of greens, forever bee honey, and then the forever active pro B, if you can afford them. Yes, thank you. So I think we're almost through. Time is fast spent, and we only have 1 minute to go. I will allow our host, if there's any information, we close. Thank you very much for giving me this opportunity to make this little contribution to all of you. Thank you very much. I really appreciate, and I also pledge that you also extend the recorded version to your friends, relatives, and neighbors and work colleagues.
Wow,
you can also tell your friends, relatives, and colleagues. You share to them the little you know, the little you can remember about this education that has been given today. Thank you very much. Good night. Thank you. Over to you, my host. I really appreciate you for this opportunity. Thank you. Bye.
This is a sumptuous meal, so well cooked, so well put together. Thank you so much. Even as a professional, you didn't buzz with all the medical jargons. You went straight to the point, and all your explanations, you can see they were all well taken. Thank you so much, Dr. Manua. God will continue to bless you for us. So you have been an asset. You have been a blessing to every one of us. We give God the glory for the blessing of you to us. So thank you so much. I know once the recorded version is out, many of us can easily attach our link now and share with friends and family. Thank you so much, Doctor. We want to say thank you to every one of us, all who have found time to attend this presentation. May God also bless you, because if we cook and there's nobody to eat it, it will be like a wasted time. But now we have lots of people, all of us present here can share with friends and family. Will save a lot of lives. Thank you so much. Good night. Have a very great night. Sleep well, and may your weekend be good. Good night, everyone. Thank you, Doctor.